Evening, everyone, and thanks very much for being with us for what I think you will find tonight a very interesting and informative discussion. Um, I think all over this country, the progressive community is trying to figure out what those of us in Congress who are fighting for working people are trying to accomplish. And tonight, I'm very proud that we have three of the leading progressives in the United States Congress here to discuss the work that they are doing, short term, long term, where they think the country has got to go and what we have learned from this unprecedented crisis that we find ourselves in today. So we're delighted that Senator Elizabeth Warren of Massachusetts is with us. Our Congresswoman Pramila Jayapal from Washington State is with us, and Representative Mark POCAN from the great state of Wisconsin is with us. And I just want to give a overview of what I think all of you know. And that is that today, in terms of healthcare, we are facing a pandemic, the likes of which this country has not seen in 100 years. Over 60,000 Americans are now dead. A million people are infected with the coronavirus. Economically, we're seeing a meltdown, the likes of which we have not seen since the Great Depression. Unbelievably, 30 million people in the last 6 weeks have filed for unemployment, but the real numbers of people who are unemployed are a lot greater than that. And I think, as my fellow members of Congress will tell you in a moment, that what they're seeing in their own states are people who are facing hunger, people who have been living paycheck to paycheck and are now really struggling when that paycheck stops coming in. We are seeing people who cannot afford healthcare, cannot even afford to go in and get checked up and get a test to determine whether or not they have the virus, let alone anything more serious than that. We're seeing people who are unable to pay their rent, unable to pay their mortgages, unable to pay their student debt. You're seeing people living in incredible anxiety. When will they get their jobs back? Will their businesses be there when this pandemic is over? What is their credit rating going to be looking like? How are their kids going to be able to afford to go to college? And a million other issues out there. So I guess I want to say is, if you're out there and you are living in anxiety and you're a little bit depressed, hey, you are not alone. Millions of other Americans are in the exact same boat. So what I want to do tonight, focus on 3 or 4 major issues and hear what our guests are working on. First of all, we have our stable genius in Washington telling us he wants to reopen the economy as soon as possible. And I think all of us are concerned that you don't want to reopen an economy if it will result in the deaths of thousands and thousands of people who'll be going to work, getting infected, and some will be dying. So we'll talk about how do you reopen an economy in a way that is safe for working people. All of us have been working on the issue of testing. What kind of testing do we need? What kind of protocol do we need? How many kinds of tests do we need before we feel safe going into work or into school? Are we doing effectively enough in terms of tracking people who have the illness? What about treatment? Why do doctors and nurses not have personal protective equipment? So we want to talk about healthcare. We want to talk about the economy. What's the best way out? There was a piece in the paper just the other day. In Europe, the unemployment rate is far lower than it is in the United States. One of the reasons for that is what they have done, what I think all of us believe we should do in this country, is guarantee that workers continue to receive their paycheck and their benefits. And that's an issue that many of us are working on. Another issue on all of our minds is the issue of the coming elections. Without exception, every guest here is working hard to make sure that Donald Trump is not reelected president. What kind of elections do we have in November if the pandemic still exists? How do we make sure that people are able to vote? What are we trying to do in Congress in that regard? So with that, let me turn to the great senator from the state of Massachusetts, my colleague, Senator Elizabeth Warren. Elizabeth, what have you been working on Short term, what do you want to see done? Long term, to get us out of this disaster and move America in a very different way?
Great. Thanks for the question, Bernie. And thanks for getting us all together here. It's so good to be here with you. It's good to be here with Pramila and with Mark, and to talk to a bunch of progressives across the country. Look, for me, the issue is the same as it always is, and that is who government works for. We have a government that works great for the wealthy, for the well-connected, just not working so well for much of anyone else. And that's been true for a long time, and this coronavirus has just exposed how deep those inequalities run. So I think of this right now as we're in this fight to make this government work for everyone. In the very short run, let's start with the success. And here's where I want to start this. And that is a couple of months ago when this first started happening and we're first getting testing, you may remember that the information being collected officially were two pieces of information about everybody who could get a test, because everyone was struggling to get the test. And that is what was the age of the person and what is the gender of the person. And that was it. And so they were doing all the analysis and trying to figure out what was going on, basically based on where you were and those two things about you. So I started thinking about this and talked with one of the congresswomen from my area, Ayanna Pressley, about the fact that African Americans, we know, have enormous health disparities, much greater likelihood of having diabetes or having other serious health conditions, and more asthma and lack of access to adequate health care. So we started pushing because we were concerned about whether or not there were enough tests being done in African American communities and other communities of color, and whether or not what those tests would reveal about people's vulnerability to this virus. So we started agitating for this, and in the latest Corona package, we actually got it. So the data are now being collected, and that's step one. And it does show that there are enormous inequities. And now we have the data on race and on ethnicity, along with the data on gender and on age. So this is important scientifically to know what's happening. It's important for managing the crisis, but it's also important for making sure that we don't just study this after the fact and say a lot of people were left behind, but that we actually get care into those communities now, get tests into those communities now, because that's what we're all about. We are progressives who believe in making change and making change now. So now is the next step, and that is to be pushing the government to make sure that they are getting those resources in. A piece that is right at the top for me that I'm also working on right now is something called the Essential Workers Bill of Rights. Think of it this way. Who are the essential workers in America? Turns out it is not the investment bankers. No, it's the doctors and the nurses. It's also the people who mop the floors in the hospitals and the people who stock the shelves in the grocery stores, the people who are doing the long distance trucking to make sure that we get food into those grocery stores, and the people who do the short deliveries to make sure that food lands on our front steps. In other words, all of the people who've made it possible for the rest of us to be able to shelter in place. Those are disproportionately women, disproportionately people of color, and disproportionately low-income workers with very few rights in the workplace. So an Essential Workers Bill of Rights starts with health care, that every one of them is entitled. If you got to show up to work, you're entitled to proper protective equipment, and you're entitled to full health care coverage if you get sick. If people are going to have our backs and put their lives on the line to do this work, then we ought to have their backs to protect them. And the second part is always the economic part. You always go right to the heart of this, Bernie, and that is how people are being left behind. So for the Workers' Bill of Rights, it's hazardous duty pay for people who are showing up and exposing themselves by coming to work every day. It's also making sure that they have childcare available to them and that their ability to unionize, and if they're already unionized, their collective bargaining rights are fully protected. A lot of folks are looking around right now and saying, I need somebody on my side, and that means they need a union. And protection for whistleblowers. Somebody says not safe working condition, you shouldn't be able to fire them for that. So I think the Essential Workers Bill of Rights is a place that as progressives, we should be on top of. And here's the best part. You think about those essential parts, that's what we should have for all workers going forward. But let's start with the people who are on the front lines today. The people who have our backs, we need to have their backs. So those are a couple of the things I'm working on.
Great. All right, we're going to get back to that, Elizabeth. Thanks very much. Pramila, what have you been working on?
Yeah, thanks, Bernie. And it's great to be here with you and with Elizabeth, our two strongest progressive champions in the Senate, and of course with Mark, my wonderful co-chair of the Congressional Progressive Caucus. Here's what I've been thinking about. Yesterday, we crossed the awful mark of having lost more American lives to COVID-19 than we lost during the entire Vietnam War. As you said, 30 million people who have filed for unemployment due to this virus, many more that haven't even been counted. And Elizabeth said, disproportionate burden on women, folks of color, seniors, and people with disabilities. Now, we've done some good things in the packages we've passed, but I really believe that it's just not enough for the scale of the crisis. We got to think bigger. And we got to meet that scale with a real people's recovery, with real economic relief, protecting healthcare for everyone, and safeguarding our elections. And all of those things have to include everyone, regardless of citizenship or anything else. And so that's why the Congressional Progressive Caucus is leading the way. We're pushing for inclusion of Elizabeth's Essential Workers Bill of Rights, ensuring healthcare proposals you and I, Bernie, have introduced together, and then protecting paychecks, as you said. And I want to just spend a minute on why the goal of stopping mass unemployment is so important. This is what I've been spending a lot of time on, is my Paycheck Guarantee Act, which you and colleagues have introduced in the Senate as well. I believe that mass unemployment is a policy choice, and we can choose differently. It's good that we've expanded dramatically unemployment insurance. That's important. But we all know that it's way better to keep workers in their jobs, and that this level of demand for even the unemployment insurance that we have is crippling those systems. There's also a lot of people that just don't qualify for unemployment insurance, but also keeping your job, as you said at the very beginning, it is less anxiety for workers. It allows businesses to get back to work without retraining and rehiring. And let me tell you something, it's hard to go from the unemployment system back into a job, particularly if you're Black or brown. So we know that when you lose your job, you also lose your health care. So the Paycheck Guarantee is really designed to make sure that we can help workers and businesses. It allows businesses, nonprofits, even governments that are facing, layoffs because of drops in revenue, to get a grant, not a loan, but a grant that covers paychecks, benefits, and some basic maintenance costs. And the funds would flow directly from the IRS and payroll processing firms to the entity, not through a bunch of banks that have never, frankly, done us a lot of good in reaching people. And it would be retroactive to March 1st so that we can pull people back off unemployment or furlough, and scalable so that businesses that are partially operating can get partial grants. Bernie, I just want to end with this. It's not just an economic plan. It is also a public health plan, because job number one for a strong economy is that we've got to beat the virus. And if we're going to beat the virus, we need people to stay home until we have strong testing and contact tracing in place. And to keep people home, they've got to be able to get a paycheck so they can put food on the table and pay their rent and not feel pushed to go back to work so quickly. As you said, so many countries have already put this into place. From Germany to Singapore to South Korea, we can do it too. And I believe we can win on this for the next package.
Okay, Pramila, thank you very much. Mark, what have you been working on?
Sure. Well, first of all, thank you, Bernie, Elizabeth, Pramila, for all your amazing work on behalf of the American people. It's really an honor to be here with you. As Pramila said, the Congressional Progressive Caucus, which people should know is about 40% of the Democrats in Congress, have been fighting for families and working families across the country on the next COVID package, as we have on the previous packages. And this time we're working with many progressive grassroots movement groups as well to get things done. We've really broken it out into 4 areas. One, we want to prevent layoffs, protect paychecks, and allow small businesses and nonprofits to grow and flourish. That includes the federal Paycheck Guarantee that Pramila just talked about, as well as expanding and improving our work share programs. We want to provide immediate direct relief to individuals and families, expanding and having monthly direct cash assistance to people, expanding social safety net programs, providing for debt relief and financial protection, and expanding housing protections. We want to third, protect the public health, and that means protecting the essential workers that Elizabeth was talking about, ensuring full health coverage with no out-of-pocket costs for COVID care. We want to support our local, state, and tribal governments, and we want to prohibit price gouging on drugs and care. And fourth, and finally, we want to ensure safe elections. And I'll tell you, coming from Wisconsin, where we were the poster child for why you don't want to have an election during a pandemic, we really need to make sure that we have a vote by mail option in this next package for November. We don't want Donald Trump to mess around with the election. We have to have a fair election. But in Wisconsin, a Democratic governor tried to stop our election. The Republicans, unfortunately, through their Supreme Court in Wisconsin, a conservative court, overruled it. The U.S. Supreme Court, the night before the election, changed the rules on us. And by election day, we had 5 polling places for the entire city of Milwaukee. We had National Guards people working as poll workers. And we have now 52 people who've contacted COVID-19 because we had the elections in April. Clearly, the answer to all of this is to have something that would work along the lines of vote by mail. We need to support our postal service as well as part of our principles, but this would really be something that we can do now. It's nonpartisan, and Bernie, 70% of people in Wisconsin voted by mail in that April election through absentee ballot. That means conservatives, progressives, independents all prefer not to get sick when they go vote. This is a good solution, and I hope we can include that as well.
All right, thanks very much, Mark. All right, let me start off. There's a dozen issues that are out there. Our friend in the White House, Mr. Trump, talks about reopening the economy. How do we reopen an economy in a way that is safe for the American people and doesn't lead us 5 months from now into another terrible pandemic? Who has some thoughts on that one?
Well, part of it has to be testing, Bernie. You know that. We've talked about this, and we got to put more money into testing. And when I say testing, I don't mean measured in the tens of thousands. I mean measured in the tens of millions. If people can't be confident that everyone who's out there has been tested, who wants to go into a grocery store? Who wants to go into any place if people aren't being tested? And by the way, it's time to start pushing for the 15-minute tests, not the ones that take days to get results. And it looks like we've got good progress on this, the saliva tests, but it means we got to have, this is part of infrastructure now, testing. And then the second part has got to be contact tracing so that we can track this thing and know when a spot is heating up before it's spread all the way through a population.
Good. Pramila, what does it mean that we have a president who is telling workers that they should go back to work, even though it is quite possible that going to work will result in them getting terribly sick or maybe dying? What do you think about how we create a safe workplace so that people walk in and say, you know what? I don't have the virus. You don't have the virus. Let's get to work. How do we do that?
Well, what Elizabeth said about testing and contact tracing and isolation, I would add to that, because when you have contact tracing, it means you're identifying who was in touch with whom. And then when you identify those people, you have to isolate them. And in some parts of the world, they actually take those folks and they put them in a separate place in a hotel or a hospital or whatever. We are thinking that we will do that in people's homes. And the perverse irony here is that the very people who are going to work to do this essential work are actually the people who can't stay home. So we're only able to stay home because they're going to work. So when Trump says meatpacking plants should continue to operate, it is so cruel and callous because these workers are being forced to go to work. Now, even if you didn't think it was a moral issue, which I know everybody on this call believes it is a public health crisis if we are forcing people to continue to go to work and, get sick and then continue to spread the virus without any way to protect everybody around. So that...
You know what, Pramila, just building on what you said, what is so outrageous and unspeakable is that if these workers do not go to work, they're going to lose their unemployment.
Yeah.
That's right.
Which means they are given the choice about going to work in an unsafe environment and getting sick, or not going to work and starving and not being able to take care of their family. All right, Mark, what's your take?
I'll tell you, I agree. The testing, the contact, the tracing, the isolation is important. But also, we have to remember, as a small business owner, Bernie, of 32 years, my business is hit like so many others. I have a small union printing shop. My division of my union, almost everyone has been laid off or now put back on in some cases because of PPP loans, because we deal with a lot of meetings and conventions and apparel and things that people aren't ordering right now. And that's not going to change in 8 weeks when the loans end, which is why I think some of the ideas that we're talking about, a national paycheck guarantee like England and Denmark is doing, makes a lot of sense, because it's going to continue to allow people to have employees who can then work either from home or at work safely, following all those other conditions. But business is going to ramp up slowly. It's not like a switch. It's more like a dial. And we have to be very cognizant of that as we're dealing with things.
Okay. And now all of us on this panel understand that healthcare is a human right. It's not simply an employee benefit. Short term, what do we do to make sure that in the midst of this crisis, everybody in this country can go to a doctor, go to a hospital if you have to, without worrying about the cost of that bill? What do we do?
So I'm happy to take that. You and I have a proposal that would cover the costs of everybody through Medicare. I think that we had a broken healthcare system before this crisis. We had 35 million people uninsured, another 30 million underinsured. And this is the projections are another 35 million people will lose their health coverage. So, we have to make sure that we cover the healthcare costs right away. Now, I also believe we can expand Medicare to cover people on unemployment. We can make sure that we put in place some core factors that allow people to not have their healthcare tied to their jobs. That's always been a bad idea. And to contain the costs within the healthcare system, because people can't afford this on top of everything else they were dealing with.
And Elizabeth or Mark, what are we learning about a healthcare system in which many, many millions of people are losing their health insurance because they got laid off from their jobs? Any lesson to be learned here?
Well, yes, we know that tying healthcare to your job does not work for millions of people. And it particularly doesn't work when we hit a crisis. And, I just want to tie those things together because I think this is really important. For so long, the dominant over and over message has been, how is it that corporations could cut costs, could ratchet down, could tighten up? And the consequence of that, we're now seeing. We have a system that doesn't have much flex or protection at a time when a crisis hits us. This one is a health crisis, the coronavirus, that we hadn't seen this particular virus before, but come on, we've seen the health crises around the world, and we've worked hard, we've averted them in the past. But you have to think about building systems that are resilient. And the way you build a resilient system is everyone has access to healthcare. Everyone has access. And people aren't saying, oh my gosh, I've got a fever, I'm feeling sick, I've got chills, but I can't afford to go to the doctor. I can't afford to go into the emergency room. And again, it goes back to a point Mark made, and I think you're exactly right, and we should be underlining this as progressives. We believe this is a moral issue. I do. I believe it is a measure of who we are as a people and the kind of nation we want to build. But if you don't have a moral bone in your body, you should nonetheless.
Why are you talking about the President of the United States like that, Elizabeth? That's not nice.
You know, I just call it the way I see it. Nonetheless, you should be strong on healthcare for everyone because it becomes a public health issue. Every person who says, I feel bad, but I still got to show up at work. I feel sick, but I can't go get medical treatment. I know I've been exposed, but I can't afford to get somewhere where I can be isolated and miss time from work. Every one of those people puts everyone else at risk when they come in contact with them. So the way we build a more resilient country is that we build these safety nets that protect us every single day and are in place when we hit a crisis.
Well, let me pick up on that. What does it say about a system in which we now spend twice as much per capita as the people of any other country, and yet we have doctors and nurses in America putting their lives on the line because they don't have a mask to protect them, or gloves, or a gown? What does it say about our public health system? Who wants to jump in on that one? Pramila or Mark or whatever? Mark?
Sure. Well, first of all, I mean, I think the good news is the public gets this. We're seeing the public moving towards strong support for Medicare for all, for universal health care. I think it's interesting. A politician usually doesn't want to be in PolitiFact. And I got one of the rare truths they gave out when I said, we are the only industrialized nation in the world that doesn't have universal health care. We're the only industrialized nation. And it got true because unfortunately, it is true. And people are really seeing with this pandemic why it's so important that everyone has this healthcare. And when I was on the campaign trail for you in Dubuque, Iowa, Bernie, I met someone from my district who was down there campaigning, talked about her son who had some mental health issues. Because of it, he got addicted to drinking. And through this, wound up getting incarcerated. While incarcerated, he finally got the healthcare he needed. He couldn't get healthcare for mental illness prior to that, and got treated for Hep C, a drug, by the way, that I think people appreciate. $1,000 a pill times 90 days to get cured is outrageous, and that's the system we have. But when the son got out of prison and couldn't get healthcare, within a week, they died of an overdose. And that, unfortunately, is the real face of not having a healthcare system. When you're the greatest country on the planet and we don't have the greatest healthcare system, people get what's wrong with that.
Hey, Mark, we don't have a system. Forget the greatest. We don't have a system.
That's true.
Pramila, you've all noticed something that is, again, to my mind, unbelievable. We are in the worst healthcare crisis in modern American history, and yet we are seeing hospitals on the verge of bankruptcy. We're seeing doctors and nurses being laid off, clinics facing bankruptcy. How in God's name, in the midst of a major crisis, are we laying off doctors and nurses? What does that tell you about the current system?
I mean, there are so many things that I think are wrong. And, I'll focus first on your question about hospitals. When you look at the economics of the hospital system, you have to incorporate the enormous administrative costs that hospitals are bearing. And rural hospitals get really screwed in all of this because they don't have the same kind of ability to bring in revenue through elective surgeries and other things. They are much tighter on their margins. And so the whole system is built around a for-profit model, and hospitals are not immune from that. They have to have hundreds of employees. In fact, in Elizabeth State, I talked to a major doctor of a major hospital there who told me that he has 300 employees at the hospital whose only job it is to fight with insurance companies to get claims paid. So our entire, and you are right to say it's not a system. It's a bunch of things that are kind of pieced together, and the only beneficiaries at the end of the day are the for-profit insurance companies and pharmaceutical companies who make a lot of money. But there's another point I want to bring in here, and we've had this conversation before about, Elizabeth talked about resilient systems, and I think that's a really important way to look at this, because if we had a Medicare for all system in place, I think about what would have been different. And first of all, we would have had a centralized ability to provide healthcare much more quickly, ensure everyone had testing, treatment, etc. But also, Bernie, we would have had people who didn't have the underlying chronic health conditions that came about specifically because they have delayed treatment and all of the drugs that they needed, and that they have been put in this position of having these chronic health conditions that ironically make them more susceptible to getting COVID and ultimately to dying. And so I think this is a really important point about how other countries will emerge from this far more quickly because they do have health systems that can, even though they've suffered deaths, they do have more resilient systems that are designed to protect the people and not the biggest corporations.
All right, let me ask you this. I know in my state of Vermont here, and I'm sure in your states as well, people are dealing with enormous anxiety. Tomorrow's May 1st. Happy May Day to everybody. But among other things, that's when the rent is due, and your mortgage payment is due, and your credit card bills are due. What do we do to make sure that people are not forced from their apartments or their homes or go more deeply into debt, having to become dependent on payday lenders? What do we do? What's the short-term approach to that? Elizabeth, you want to jump in on that?
Part of it is that we need a moratorium on debt collection against people. And that means on evictions, it means on foreclosures. And as we talk about price gouging, and I'm all in. In fact, we've got a proposal to stop price gouging. I know we're all on. But part of it, too, is to remember there's also something called credit gouging. It's not known by that term, but that's what payday lending is all about.
Yeah.
People who get tangled up, and the way the payday lenders make their money is that they have structured the terms so that more people will fail and keep rolling those loans over and over until...
Elizabeth, if you could, remind people what the interest rates are at some of these payday lending places.
The interest rates often run to 200%, 300%, 400%, and it is not unheard of to have interest rates that are literally in the 1,000% range. And here's the thing. You hear these stories from people. Let's go back to how this feels to people. Someone comes in, it's an emergency. They got to have money because they got to make the rent. They've got to have money because they got to pay for childcare. They got to have money to put food on the table. Payday loans, you have a job. Those are the only people who are getting these loans. So they come in, they show their past two paycheck stubs. They borrow the money. The money then all has to be paid back at once in 2 weeks. And if you don't have the full amount of the cash, they will happily, for a fee, roll it over, roll it over, roll it over. And that's how people get caught.
You have all heard the statement that it is very expensive to be poor.
It is.
Poor people are paying 50% interest rates. Rich people pay 2%. Mm-hmm. Poor people go to these little shops to buy food, twice the price of a good grocery store, et cetera, et cetera. That's a whole other story, which next time we'll get into. But I want to use the moments that we have to take a deep breath and try to reflect upon what are the lessons? What are we going to learn out of our unpreparedness for this crisis, out of the inequities that we are now seeing every day? I think Elizabeth began by, or Pramila as well, talking about the unbelievably high rates of death in this pandemic among poor people and African Americans and Latinos, who all have, or many of them have pre-existing conditions for a wide variety of reasons. Seeing so many people desperate out there. You would not think that in the richest country in the world that if people lost their paycheck for a week or two, they would find themselves in absolute desperation. But of course, that is exactly what is going on. So what are the lessons that the American people should learn from this horrific moment in American history, so that when we get out of it, we can create a new America, a transformed America, a more just America. Mark, do you want to take a shot at that?
Sure. Thank you, Bernie. And, I think what we're noticing is, especially, let's use meatpacking industry as one classic example. Many people who are working in the meatpacking industry are Latino Americans. And in Green Bay, Wisconsin, Brown County, they have a huge surge. It was one of the biggest surges nationally last week because of people working there for low pay in terrible conditions, and now got COVID-19 and could can't take care of their families because of what's going on. And the president uses Defense Production Act not to get personal protection equipment for frontline workers, not to get test kits and reagents to run the test kits. He does it to ensure his big corporate entities who run these meat packing facilities do well. We have to really recognize that you can do this and respect and really emphasize social and economic justice, especially with a lens for racial disparities. And we're noticing that so often on why is it these high numbers of people in the African-American population, Latino population have COVID-19 versus others. And we really need to now use this time as we put the next package together to make sure we do it with a lens to make sure that everyone is treated equally and everyone has access to assistance, not just the 1%, not the people who got Donald Trump's corporate tax cut, but everyone who's working hard every day. And we're seeing it's those workers in the grocery stores who are sweeping up at the hospitals, et cetera. So I think this is a real good opportunity for us to put more not only just progressive legislation, but really focused on racial and social justice.
Pramila, what lessons do you learn from in terms of this crisis?
Yeah, and our first case was diagnosed here on January 21st. So people here, Bernie, are going into their third month of not having a paycheck and being laid off. I would say three things. One is the role of government. Government has been maligned by conservatives, Republicans, and even some in our own party. We see now that government is the force that needs to equalize opportunity for everybody, whether that's through healthcare, childcare, a number of other policies that allow people to really have the things they need. So that's one. The second is workers are the engine. We measure things by profits, but workers are the ones that produce those profits. And none of us would be able to do anything without the people that are out there doing that essential work right now, whether it's our postal service delivery folks or whoever. And then the third thing is, and I know this sounds sort of hokey, but we are deeply interconnected. Any thought that we are not has been blown away by this crisis. And so we have to remember that. You can't lift up 1% and expect the rest of the 99% to be fine. Public health crisis is the perfect moment to recognize that we are all deeply interconnected. And if you don't believe in the morals, believe in the fact that the virus does not discriminate here. And it shows us again how what one person does, whether it's staying home and sheltering in place, or whether it is being able to get testing, matters for everybody else.
Elizabeth, what lessons do we learn in terms of this pandemic and income and wealth inequality? It strikes me that we are seeing wealthier people heading out to their summer homes, escaping populated areas, while low-income workers are forced to go to work and put their lives on the line. What are the lessons do we learn about income and wealth inequality in this particular moment?
So it's a good question, Bernie, because I think what we see in front of us is that inequality kills. Inequality kills the people who are on the short end of the stick, the people who don't get health care, the people who are forced to show up to work, the people who can't get protective gear. But ultimately, inequality puts us all at risk. That there's no such thing as a pandemic that is only going to be confined to lower income workers. It spreads everywhere. Once it hits the nursing home, it hits the high income residents as well as the people who are there working for minimum wage. It hits everyone. And for me, that is the heart of it. Progressives talk about making a government work, making a country work, making an economy work for everyone. And ultimately, that's what this pandemic is showing us. Nobody is going to be safe in this country because they somehow walled themselves off. Yeah, they got somewhat better treatment. They do by their money. Boy, no kidding about that. And it isn't right. But here's the thing. Everyone is put at risk. It's true here on healthcare. It's true on climate change. It's true on an irrational foreign policy that puts us at risk. In other words, we are ultimately interconnected, as Pramila said. And we build a stronger, more just country, a stronger, more just economy, an economy that pulls in everyone. It works better for everyone. Yeah, the richest might not be quite so rich, but in return, we will have a stronger, more resilient economy and a stronger and more resilient nation, and that will benefit all of us.
All right, I understand that our panelists have various meetings that they're going to have to go to, and I appreciate very much they're spending some time with us tonight. Last question. A lot of people back home are feeling, real worry about the future of this country. They don't quite know what they should be doing. Pramila, why don't you and everybody take a quick shot at this? What's your suggestion to the working people of this country, low-income people, young people who want real change? Where do we go from here?
We have to organize. We have to know that the one thing that the other side would love to have is for us to have no hope. And we have to remember that great things in this world have never happened overnight. They've happened because people are organizing. They're organizing in the streets. They're organizing in Congress. They're organizing in whatever forums they have, and insisting on a vision of justice, of racial equity, economic equity, equality, a belief. And I like to think about this as the way that Desmond Tutu talks about it, which is the difference between being an optimist and actually having hope. Optimism and pessimism are temporal. They're ephemeral. They change from day to day. But hope is actually a deep, unshakable faith in something else that we create with our hands. We create with our energy. We create with our hearts and our commitment to a different kind of a vision, a refusal to back down from that hope. And so that's what I would say to people everywhere. Keep that hope. Be a hopist.
And you said it very well. Mark, what's your message out there to folks who are watching?
Sure. Well, I think there are a lot of people who are just sick and tired of being sick and tired. And to those folks, I would say we have the ability together collectively to have our voices heard through the ballot box. The 1% has 1% of the vote if we all get out and vote. And we can really have a big impact and elect people who share the idea that we should have Medicare for all, that we have a Green New Deal to look after our planet, that we could raise the minimum wage to $15, and we can stop the endless wars in this country. If you care about all of those sorts of issues, we have that ability through our vote. I was a big fan of Paul Wellstone when he was in the Senate, of course, a neighboring state to Wisconsin. I know one of his famous sayings was, "We all do better when we all do better." And I printed that on a bumper sticker for my campaign in the last cycle because I believe so passionately about it. We can do this by looking out for our friends and our neighbors' backs. We can do this by getting to the polling places, and we can do this by working for people who share your values. And together, we are going to come out of this. And I really believe we will come out of this stronger because people are just tired of being sick and tired.
Mark, you quoted Wellstone. I often quote Nelson Mandela, who says, "It always seems impossible until it is done," which I think is a very profound thought. Elizabeth, what are your concluding remarks to folks? What role can they play?
I completely agree with Mark and Pramila. And again, thanks for having us here together. I'm going to be really specific, though. And that is, we're negotiating right now in Congress for the next response to the coronavirus. So let me ask everybody, hashtag stand with essential workers, right? This would be a huge lift for workers across this country and establish that this is what people are entitled to in the workplace. It's not called the essential workers things we do out of the goodness of our heart. It's the Essential Workers Bill of Rights, the things that workers should be entitled to. So stand with essential workers and stay engaged. Stay engaged. We need you. Pramila calls it organizing it. I call it, boy, texting and phoning, and get in touch with your senators, get in touch with your representative, because it is only if we lift our voices that we will be heard, and we need to be heard.
On that note, let me thank Elizabeth Warren, Pramila Jayapal, and Mark POCAN for the great work they're doing and for being with us tonight. Okay, everybody, we'll see you all soon. Stay well.
Thanks, Bernie.
Bernie.